You are now listening to Protecting Your Nest with board-certified family medicine and obesity medicine specialist Dr. Tony Hampton. For more, visit drtonyhampton.com. Welcome to the Protecting Your Nest podcast, where every week we walk together to a better understanding of what are the root causes of so many of the chronic medical conditions we are trying to avoid in ourselves, our families, and society as a whole. We use a simple acronym, a nest and a rope, as a simple reminder of the root causes of chronic disease and what we need to do to avoid them. The nest reminds us to have proper nutrition and to take a break from eating with periodic or daily fasting. We also want to focus on exercise, avoiding stress, and increasing sleep. We also want to avoid negative thinking and trauma. The rope reminds us to be in healthy relationships, to avoid harmful organisms and pollution, while also making sure our emotions are protected while not being victims to old beliefs that don't serve us. Today, we have the pleasure of better understanding the root cause of dementia with one of my Twitter buddies, Amy Berger. So if you are listening to this podcast and are at risk for or simply concerned about getting dementia someday, this episode is for you. Finally, there is hope. So people, please share this episode with friends and family, since the idea of losing one's memory or getting any type of cognitive impairment is really one of the most frightening things that we all think about as we age. Amy's research provides some rays of hope for a condition that conventional healthcare seems to not have found any good answers for. Amy is a U.S. Air Force veteran and a certified nutrition specialist who specializes in using low-carb and ketogenic nutrition to help people reclaim their vitality through eating delicious foods. She blogs at www.tuitnutrition.com, that's T-U-I-T Nutrition, where she writes about a wide range of health and nutrition-related topics that include insulin resistance, metabolic syndrome, weight loss, thyroid function, and more. She is definitely an internationally known speaker in the low-carb and ketogenic nutrition space, has authored peer-reviewed journal articles, and serves on the review committee, believe it or not, for the certification exam for all the nutrition specialists out there. She is author of the well-received book, The Alzheimer's Antidote, Using a Low-Carb, High-Fat Diet to Fight Alzheimer's Disease, Memory Loss, and Cognitive Decline. And she recently, and I think a lot of our low-carb fans are happy to hear that she got a book now called The Stall Slayer, 7 Roadblocks to Keto Fat Loss and What to Do About Them. And she released that around June the 27th of 2020. She does have a bachelor's degree in creative writing from Carnegie Mellon University and a master's in human nutrition from the University of Bridgeport. Amy, first of all, I just want to thank you again for your service to the U.S. Air Force. And believe it or not, I wanted to be a physician pilot in the Air Force, but my poor vision was a little bit of a barrier, so I wasn't allowed to pursue that goal. But I really want to appreciate all the work you're doing, not only in the dementia space, but in the low-carb community. So welcome to the podcast, Amy.
Thank you so much. That was such an incredible intro. I think you might know more about me than I do.
Well, you know, as I'm new to the podcast space, I want to act like a really good podcaster and do just a little research in the midst of a completely busy life. But for you, Amy, no problem at all. But before I let you make some comments, I wanted to remind everybody that after the podcast, Amy and I will do a post-podcast show on Facebook and YouTube Live. And we're going to talk a little bit differently. Instead of focusing on dementia, which is the focus of this podcast, we're going to transition to more lifestyle, diet-related issues. Essentially, we're going to talk about when you're losing weight and you get a stall, what can you do about it? So that's going to be something we'll have in the show notes for you to check out at your convenience. Having said that, I've given you that interesting and insightful introduction. What would you tell the folks that's listening, the reason for you deciding to get into this whole dementia space as a nutrition person? That doesn't necessarily make sense for most people. So kind of explain how that all happened.
Right. Well, I have no family history of Alzheimer's or any kind of dementia. I do have a family history of type 2 diabetes, cancer, obesity, and stroke. So we're all stocked up in the family without dementia. But I had already been eating a low carb or ketogenic diet myself and learning about this for a few years before I came across anything about Alzheimer's and memory loss. And it was in Gary Taubes's book called Good Calories, Bad Calories, where I first learned about any potential connection between glucose and insulin and Alzheimer's disease. And it was kind of interesting because I never heard of anything like that before. But it wasn't until a few years after reading that book when I was in grad school for nutrition and I had to pick a thesis topic. And I said, let me go back and look at that Alzheimer's thing and see if there's any research on that. Like, is there even enough published scientific research that I could write a thesis on it? And lo and behold, when I started looking through the medical journals, it was really everywhere. And I was shocked because, like I said, I had already been learning about low carb and keto myself for a few years, and I had never seen this before, except in Gary's book. But then when I started looking for it, there it was hiding in plain sight. And so I did my thesis on that topic. And after having graduated, I said, this is really potentially life-saving and life-changing information. And if right now it's sitting on my laptop doing nothing, it's not doing anybody any good, how can I get this information to the people who need it, to the loved ones and caregivers of people with these kind of conditions? And so I wrote a book, which, turned into the Alzheimer's Antidote, which is my book about this topic. And really, that's how it all started. I just couldn't imagine keeping this to myself when I really feel that it's very, very powerful information.
Life is so random. It's such a random thing. I remember talking to a neighbor who has since left the neighborhood, and he literally went to the class of a classmate in college who was in this paper class. And he just went to sit in the class one day, and the teacher said, "Would you be interested in learning more about this?" And he thought it was kind of interesting. But he said, "Okay, I'll learn more." Next thing you know, he changes his major to the topic of paper. Don't ask me what that means. And now he's like over this big, huge paper factory, does really well. But it was just a chance occurrence. Just like with this book, it was just, you just happen to read something randomly, you remember it randomly, and then you decide to attack a topic that's just like going to impact so many people. And I just thought about that as you were sharing that. That's just amazing how life is so random. So just like when you meet somebody, you end up marrying them, But so having said that, when you think about this, dementia's like all over the place, right? So just like a lot of other health conditions, what do you think explains the rise in dementia worldwide? Like it's all over the place.
Oh boy. Well, that's kind of a big answer, and I'll give it as succinctly as I can. When Alzheimer's, it's not a brand new disease. It is, it's not brand new, but it was rare until recently. It was very rare, and it really used to only happen in very, very elderly people. This was somebody's grandfather, somebody's grandmother, well into their 80s or 90s. And now we're starting to see people really in their 50s and 60s being afflicted with this, which really is young. I'm in my 40s now, and the older I get, the younger 50s and 60s and 70s sound to me, right? So this is no longer a disease of older people. And just like, if you look at things like type 2 diabetes and cardiovascular disease and obesity and metabolic syndrome and hypertension and all these things, they are absolutely exploding in incidence, right? And again, just like Alzheimer's, none of these are new, but they used to be rare, and now they are everywhere. And nobody even debates whether or not diet and lifestyle play a role in type 2 diabetes and obesity and heart disease and all that stuff. So, why is it that when it comes to Alzheimer's, we dismiss even the mere possibility that this could be every bit a diet and lifestyle disease, just like all of those other chronic, non communicable, meaning you can't catch it from somebody, it's not contagious, just like all of those other illnesses? Why aren't we even looking at the possibility that maybe the brain can be affected by diet and lifestyle just like all the other parts of the body can? And so, in my book, I write about that more and more Alzheimer's looks like a metabolic disease, like and one that we probably have a lot more control over than we think we do.
Yeah, I can believe that. In fact, I shifted my thinking process a little bit as I learned about the root cause of disease, which is really the foundation of my nest and my rope. I realized that the foundation of chronic disease is, for most chronic disease, is metabolic disease, metabolic syndrome. So you would have had to pay me a lot of money to believe that there was some connection between, what we're talking about and dementia. And it's just, but the good news is it gives us hope. And I think that for a lot of people listening, I want to just I know when it's funny, my last podcast with Dr. Andy Fung, I made sure that we went to school a little bit. So I'm going to take a moment to go to school just briefly and just share a little bit about this whole idea of dementia. And I want to start by sharing the following, which is that I read some stats recently which blew my mind, which said if you're 60 and older, your risk of getting dementia may be at 1% at that age, right? But then if you get to 85 and older, and as you suggested, we have an aging population, it could be as high as 50%. And if that's true, half the people or yourself will have dementia if you live to 85 or later. It's just, when I heard that stat, I said, that has to be a misprint. It's amazing. So having said that, the four major types of dementia that most people think about are the ones we're talking about primarily today, which is Alzheimer's dementia, pretty much the most common. And you think about, people hear terms like amyloid plaques and tangles in the brain, and ultimately those things can build up and cause problems. Those problems include cognitive decline, and cognitive decline is things like memory loss, how you sequence your actions. In other words, not knowing what my next, thing I should be doing if I'm driving, where do I go? You get a little confused, how we communicate, and also just recognizing objects. And I always tell my patients, if you can, if you misplace your keys, that's one thing. If you don't know what your keys are used for, that's another. And then you have the second common cause, which is vascular dementia. Clearly, that's a metabolic issue. And when you have poor circulation on top of all of these symptoms you see with Alzheimer's dementia, you think about vascular dementia. The third most common is Lewy Body. And Lewy Body folk tend to have visual hallucinations. They have frequent swings in their alertness, so they have sleep issues, and of course they have your regular other dementia-like symptoms. And then finally, frontal temporal dementia is another very common one, and those folk tend to have behavioral and emotional changes, followed by those cognitive impairments and sometimes poor hygiene. So those are the ones we tend to think about. You have others that, Parkinson's can kind of have some dementia symptoms, one called Huntington's, and people who have deficiencies and things like B12 and thyroid disease. And the only other one I'll mention is normal pressure hydrocephalus, where you have balance and gait issues, and continence, where you lose your urine, and of course those cognitive issues. So I just want to kind of frame our conversation so that people are thinking that it's not just about Alzheimer's dementia, there are other things out there. So, but now that our listeners know a little bit more about the differences in the types of dementia, could you explain what you feel are things we can do with our diet to help improve dementia, and if any of those interventions go beyond the Alzheimer's dementia that we're talking about today.
Right. So my what I've learned about mostly is Alzheimer's. I think some of it will apply to other types of dementia, but the main things that I think, yeah, I guess we have to take a step back, and I kind of have to explain if people have never heard, they now regularly call Alzheimer's disease type 3 diabetes or diabetes of the brain. And right off the bat, that tells us there's something going on with glucose or insulin in the brain. And that phrase, type 3 diabetes, comes because the main problem in the brain of somebody with Alzheimer's is that the brain is no longer processing glucose properly, and glucose under most circumstances is the main fuel for the brain. And so if your brain is not properly using glucose, your brain cells essentially starve to death. It's a fuel shortage in the brain. And we don't really know why this is happening. We can't say for certain what the cause is, but that is the ultimate problem. And the phrase type 3 diabetes, as much as I love it, it's a little bit misleading because you might be thinking, well, my mother has Alzheimer's, but she's not diabetic. She's thin and she's healthy or whatever. My grandpa has Alzheimer's, but he doesn't have diabetes. The problem with how we diagnose type 2 diabetes is that we only ever look at glucose, right? Your blood sugar. They never look at insulin, which is a hormone that most people think of as a hormone that lowers blood sugar. It does a whole lot more than that, but one of its jobs is to help control your blood sugar. And there are millions of people, and that's not an exaggeration, literally millions of people who have totally normal blood sugar, but really, really high insulin. And their blood sugar is normal because the high insulin is keeping that in check. And even when your blood sugar is normal, if you have this chronically high insulin, you can have all kinds of problems like obesity, high blood pressure, gout, PCOS, skin tags, migraines, enlarged prostate. I mean, you name it, they can tie it to chronically high insulin. And Alzheimer's disease fits that list. It's one of the major risk factors for developing this cognitive decline and this dementia is chronically high insulin, even when your blood sugar is normal. So in order to potentially prevent this, and I always use the word potentially because we don't know for sure if we can prevent it. I like to believe that we can, but since I can't say that for certain, I have to say potential. In order to potentially sort of ward this off or at least reduce risk, we would want to keep our insulin and blood sugar levels within a healthy range for as much of our life as we can. And one way to do that is by eating a diet that doesn't massively raise your blood sugar and insulin all the time. And that's why I'm partial to the low carbohydrate or ketogenic style diet, but not everybody needs that. Some people can eat, a fair amount of carbohydrate and still have healthy blood sugar and insulin. Many of us cannot.
Yeah, you speak the language that I like to speak, and I was a vegetarian for 8 years, and I felt fine. I feel better doing low carb, but I think it's really important that we continue to message to our colleagues who are low carb, to our. I'm studying nutrition as well, and a lot of those folk that I study with are into the vegetarian diet. So we have to be able to have intelligent dialogue about this, and there's no one size fits all. So I think I completely agree with that. And I also want to pause for a moment. And for those who had not heard that term, type 3 diabetes, and it's certainly not the best term as I hear you describe it, it's very interesting to hear that term. So, but it does remind us that our blood sugars have something to do with dementia. So I just wanted to say that out loud. I also wanted to ask you, you mentioned the fasting insulin. So first of all, if you're a clinician out there listening or a patient, it probably would behoove you to encourage your clinician to order a fasting insulin level because it really will predict whether or not you're overtaxing your pancreas, and it's making a lot of insulin trying to keep your blood sugars normal. So I think that's just a good test to get, and it should become standard, I think, in healthcare. Having said that, some people also feel we should do a 2-hour postprandial test, but sometimes it's hard to do that. So what's your thoughts on a 2-hour postprandial glucose test, and rather it's practical versus doing this insulin level?
Yeah, wow, what a great question. I could not agree more that fasting insulin should be a routine part of a checkup and standard blood work, just like a fasting blood sugar is. Um, I think because in so many people, that very elevated fasting insulin will explain a lot of things that were not previously explained, like someone with some of the health issues we mentioned earlier, whose other blood work looks normal, and the doctor is puzzled and the patient is puzzled as to why is this happening. Well, when you look at insulin, oh, that's why. But yeah, the weakness of a fasting insulin test is that, just like a fasting blood sugar, the fasting level can very often be totally normal. But if you eat a meal, especially a meal high in sugar or high in carbohydrate, your blood sugar and or insulin can rise very high. And in some people, it stays very high for several hours. And that can be the major problem, more so than whether or not the fasting level is high. So I think the fasting level has weaknesses. I don't think the 2-hour test is really necessary. I think if you know the right tests to order, you don't really need that 2-hour test, because you'll see the pattern emerge. You'll see maybe slightly higher triglycerides, lower HDL. The fasting insulin might be high. The person might have a larger waist circumference, even if they're not heavy elsewhere in their body. If they have a large waist, that indicates high insulin. So you can do that 2-hour test, but I think there's a lot of other indicators that you'll see without having to do that.
Yeah, I appreciate that. I try to be as practical as possible. And, nowadays it's hard to get people to get any test because they're afraid to come to the office for anything. So I think the practicality of a fasting insulin is a good starting place. And then we can, maybe, depending on who's in front of us, maybe you really suspect it, your tests are not giving you enough information. And then you can go to the a test that may be a little bit better. So I'm totally on board with that. So I was thinking about this ideal of, a nutrition professional who obviously will look at nutrition as a way to solve problems. But I'm curious how you feel about traditional treatment for dementia, like the cholinesterase inhibitors like Aricept and maybe Namenda. I think that's a glutamate, increases glutamate in the brain. I'm curious how you feel about the traditional treatments and why they don't offer effective treatment compared to natural treatments.
Right. The problem with some of these conventional treatments is that they are a very, very small step above useless. They really do almost nothing to have any significant impact on this illness. And at very best, what these drugs do is slow the decline. They make you get worse more slowly. They don't stop you from getting worse, and they certainly don't make you any better. They just make you get worse more slowly. And the reason I think most of these drugs are failures is because they are not addressing the underlying problem. If the underlying problem is that the brain is starving because it's not able to get fuel from glucose anymore, and if there's some relationship to chronically high insulin, and there's other factors. I mean, vitamin B12 deficiency is rampant among older people. It's not just the insulin and glucose problem, but if those are the main factors, these drugs do absolutely nothing to address that. And if you are not addressing the root cause of the problem, how do you expect the problem to get better? You're really just putting a Band-Aid on a sucking chest wound, and that's really not going to accomplish much. And we see the same thing in type 2 diabetes. When a type 2 diabetic gets put on insulin, they never get better.
That's right.
Because insulin doesn't fix the problem. Insulin lowers the blood sugar, but the high blood sugar, you probably talked to Dr. Fung about this, Andy Fung.
That's right.
That
That's right.
not that it's addressing the symptom, not the actual problem.
That's right. It's a dietary disease, and now we're learning from your research is that dementia is a dietary disease. And but what I love about that, as much as, and I'll have Dr. Joan Iflin on, and she'll talk about food addictions. But the good news is that it's something you can do something about. You feel so, and I think the docs and the APNs and the physician's assistants who prescribe these things, I think they just simply feel like they don't have anything else to offer. So in the midst of a 15-minute appointment, it's easy just to write a prescription. The question is, how many docs and APNs and physician assistants actually even know the term type 3 diabetes? How many of them are understanding this ideal about nutrition as a possible path to, slowing this down or reversing it? And again, we have to be careful about language in terms of how we describe it. But Dr. Andy Fong shared a story about a patient during his podcast where the person came in with a couple of people and had, behavior that wasn't acceptable. And 6 to 9 months later, where was able to come to the clinic driving himself and by himself, but with this whole dietary change. So we know empirically that it works for a lot of people. And I just think if I was a patient, I would like to be given hope of a path to not have to, just expect cognitive decline to be the norm. So I really appreciate the work you've done. And I also want to comment on this, what I just said in terms of this lack of education. So I'm like you. I just like learning and want to grow in knowledge. So I did sign up for a master's program in nutrition, and I'm working on that. It'll be about another year and a half or so to go. But what I do notice is that my professors, they tend to lean a little on the low fat side, and even when we bring up science that supports paleo or low carb, they always frame it in such a way that that's true, however, and so you can kind of hear the bias in their language. So my curiosity is that when you did your nutrition training, how receptive were people to this ideal of saturated fat being good or bad, and just how did they perceive this whole low carb world? Was it kind of, did you feel like you were in a lion's den?
Oh, I was pretty fortunate because two main reasons. I kind of like you, I got my nutrition training after I had already been eating low carb and learning about low carb for years on my own. I was a career changer. I went back to school to do this as I was a little older. So I was able to learn a lot of the biochemistry and the anatomy and physiology in the context of what I already knew about how this way of eating works. But I chose the specific program I chose because I knew that it wouldn't be the conventional mainstream nutrition. The school that I went to had there's 5 accredited naturopathic medical colleges in the US, or there might be 4 in the US and 1 in Canada. But, whatever your thoughts on naturopathic medicine, I knew that just the presence of having that at the school probably meant that the school had more of an unconventional approach and more of an open mind to other modalities. And so and it was, the master's degree fully accredited, not some kind of diploma mill type thing. And so a lot of my professors were, certainly I didn't learn keto in university. I had to learn most of it myself, but most of my professors were very, agreeable to the notion that most people were probably eating far too much carbohydrate, far too much sugar. And most of them, especially the biochemistry professors, were pretty friendly to thinking that saturated fat was not the enemy that it was made out to be all these years, just because they know the chemistry of it. They know what the molecules look like. They know what a saturated fat looks like. They know what polyunsaturated fats look like. And so I don't feel like I ever really had to defend myself at any point. But it's really interesting because some of my classmates were vegetarians. There was one person that was vegan. And how could we learn the same science? How could we learn the same pathways and mechanisms and come away with such a different interpretation of them? But I
Yeah,
I feel really fortunate because I know a lot of dietitians, and you probably do too, that were trained very conventionally, and they really
that's
had
right.
to unlearn, and they had to kind of like deprogram themselves and really and what they do now, if they sort of help patients and clients with keto and low carb or paleo, they're really doing almost the opposite of what they were taught in some
That's
cases. So
right.
I didn't have to
Yeah.
face quite that kind of, cognitive dissonance.
Yeah, and I actually will comment that first of all, everything you're saying, it resonates with me, and with the University of Western States, it's actually nutrition and functional medicine. And I've said this before, but the foundation of my nest and rope, the rope actually primarily came from this functional medicine tree foundation. So what's beautiful about learning is that you add to what you already know. And obviously we went into our nutrition training with a different lens. However, I can now intelligently have a conversation with my professors and and my peers and talk a little bit about it in a way that I probably couldn't have otherwise. And but more importantly, I'm learning the biochemistry. I'm learning how things work. And I learned a lot of this stuff in medical school, but you have to kind of be reminded because once you leave school, you're just, handing out prescriptions and you're not thinking about oxidative phosphorylation and stuff like that, and mitochondria. So I appreciate your perspective. I was just curious because I think that part of our journey, whether it's on Twitter or doing this type of work, we have to be able to hear each other. And I know I said that earlier, but I just felt like I needed to say that a second time. So speaking of Twitter, I did tag you. And just for those who are listening, sometimes you get to know people, you just kind of attach them to your tweet. And I tagged you in a tweet from, I had heard you talk about a quote from Jeff Volek, which basically stated that keto is a really big hammer and there's a lot of little nails out there, implying that keto can solve a lot of problems. So my question to you is, a lot of docs and APNs and physician's assistants are not really aware to the extent that we are about metabolic syndrome and this whole connection between that and dementia and all those other medical conditions. So, what do you think in terms of other medical conditions that benefit from this way of eating? And so that our listeners will understand this is not just dementia, it's other stuff out there that would benefit.
Right. Well, this I love that quote from Dr. Volek, and I've heard that before, and it's brilliant because it's true. We in the keto and low carb world we could easily be accused of being sort of snake oil salesmen, right? For every problem, oh well, have you tried keto? Oh, have you tried low carb? But the fact is, there is a huge list of very difficult to treat conditions that seem to respond really, really well to this way of eating. And part of that is because whether medical and nutrition professionals at large recognize this or not, many of them are either caused or made worse by chronically high blood sugar or insulin. And so when you correct the high blood sugar and insulin, guess what? These problems either go away entirely or they get much better. And we've already mentioned, type 2 diabetes, obesity, gout, high blood pressure, migraines, PCOS, PMS gets better. There's a lot of people with some mental health disturbances that notice they get a lot better, things like anxiety, bipolar. But of course, obviously, nobody should go adjusting medication on their own. Always work with your doctor, work with a professional. But, people are, acid reflux tends to go away almost as soon as you stop eating a ton of carbs. And there's just so many non-alcoholic fatty liver. The list really, really goes on and on. And for some of these, there's a lot of published research. And for some, there's not. Some, there's just a lot of anecdotes, meaning patients and just general public people sharing their stories of, hey, I tried this diet and my X, Y, and Z conditions went away. And I don't think, you know, it's easy to dismiss those. Everyone's like, well, where's the study and where's the science? But that's where any study ever gets started. You have to have a reason to study it, and you're only ever going to study it when a couple hundred or a couple thousand people say, hey, my migraines got better when I went on a ketogenic diet, or, my acid reflux went away when I went paleo. So it's really, we sound like kooks because we just think, oh, whatever issue you have, you should try keto. But it's just that effective. It really, and the fact is, it's a diet. We're not telling you to buy any expensive product or to buy some special gadgets. There's that stuff exists for keto, but none of it's necessary.
It's
All
not
you really have to
necessary.
do is eat food that's very low in carb. And you can
That's
do
right.
that going to Walmart, going to your discount store. You don't have to buy all organic food. If you can afford that stuff, that's great. But the beautiful thing about this way of eating is that you can do it on any budget. You can do it if you're kosher. You can do it if you're halal. You can do it if you're allergic to dairy. And if it doesn't work or you don't like it, just go back to your old diet. There's really no harm in giving it a
That's right.
try. Because if it works, great. And if it doesn't, okay, have a bagel for breakfast.
That's right. And you're right. It's really an easy thing to experiment with. And man, I tell you, I listen to my patients and I share with them this methodology, and I am guilty of sometimes using that keto hammer because I see 70% of the medical conditions we face can improve with it. So I do have to kind of back off a little bit and not overdo it. But it's hard not to do it. It's almost like you have, like if somebody's listening to this podcast and they're hearing for the very first time that there's something you can do about dementia. I literally could only imagine what that must feel like if they're in the middle of that or worried about it. And I guess I think let's go a little deeper and help people understand, why this way of eating works. So when I talk to patients about their fuel source, and I talk to them about glucose, which comes from starch and sugary foods and grains, and I compare it, and I say to them, that's dirty fuel. That's like the coal mine, and you may get some energy out of it, but it's going to be dirty, and your body doesn't like it. And then we talk about fat fuel. That's a cleaner. It's like a solar panel. So that's always the example I give my patients. So I just want you to explain why having a dependence on glucose as our primary fuel and how it affects our system down to the mitochondria, and why we want to really give our brain an alternative fuel. I mean, why just make that clarity around why we want people to consider a low carb diet versus the traditional diet.
Yeah, you said it really well, and it's the analogy I actually like to use too, is that the body is like a hybrid car. We can run on a lot of different kinds of fuel. And some people do well on a high carb diet, and I really respect that about you, that it is important for us to recognize that not everybody needs a low carb or ketogenic diet, but there's a lot of people living with all these illnesses and just chronic diseases that come from just overloading the system with carbs. And it's you said it really well. I mean, think of carbohydrate as, or rather think of fat as a cleaner fuel. You burn it and there's less pollution, so to speak, less waste. I mean, it's really, without getting too nerdy about the biochemistry of it, it's just, it induces less damage. If you, let's say you're burning gasoline, and there's exhaust coming out of the car, and you have to change the oil every now and then. Just think that when you're burning fat versus burning carbs, there's less exhaust, there's less pollution, there's less wear and tear, internally to your body. And It's not a zero sum game. It's not that you're running solely only on fat or only on carbs. I mean, the body, even when you're on a high carb diet, you'll still be burning a little bit of carbohydrate, but the predominant fuel will be fat. And if you just look at the human body, we we're I don't like the word design, but the human body is we have a better capacity to run on fat. Look at the quote unquote gas tank of our body. Most of us are carrying plenty of body fat. I mean, even a lean, even a relatively thin person still has plenty of fat on their body versus, people might be new to this. This might be the first time they're hearing this. We don't have a large storage tank for carbs. Like if you imagine that the body has two gas tanks, let's say, the gas tank for carbs is really small compared to the gas tank we have for fat. So why wouldn't you want to run your body on the fuel that you have much more of and that you have much more readily available?
Yeah, it's almost like we were designed to use that fuel, but we didn't get the memo. That's what I think,
Right.
So nobody ever told us. So, wow, it's
And people need to be aware that what flips that switch, what sort of
right.
tells your body whether to burn primarily fat or primarily carbs, is the amount of carbs you eat, or rather your insulin level. Unless, excluding type 1 diabetes, which is a very different situation, if you have high insulin, you're going to be burning carbs because, I mentioned earlier that insulin has a ton of jobs apart from helping to lower blood sugar. One of the things insulin does is inhibits fat burning. I'm not going to say it stops it completely. It's never fully stopped, but it makes it a lot harder for your body to burn fat. This is why for many people anyway, not all, for many people, it can be really, really hard to lose body fat when you're on a high carb diet. Because if your insulin is high most of the day, you really have a hard time tapping into that stored body fat. You're just going to be burning carbs all day.
Yeah, it's just like anything. You kind of get good at what you practice. So if that's all your body gets a chance to practice, it's what it gets. And then it's probably, my understanding is pretty easy to burn that fuel. So your body's like, okay, this is not clean fuel, but it's pretty easy to burn. So I'll just keep burning it. So, I think about, how we function, our bodies function, and why we are who we are. And I think about even a post I did on Twitter around related to genes, and it basically said your genes are not your destiny. And I know in my nutrition and functional medicine training, they talk a little bit about how you can have genetic predispositions, but your environment is what really activates it. So, and that's why I talk about these environmental factors in that nest and rope. And I explained that in the first episode just to give people a sense of where I'm coming from. But having said that, when you think about the genetics of dementia, what can you say about that in terms of how important your genes are and your risk for getting dementia versus these other factors?
Yeah, that's a really good question because if anyone listening happens to be familiar with Alzheimer's specifically, there is a strong genetic component, but dot dot dot. There's there's a gene called ApoE4 that very significantly increases your risk for getting Alzheimer's. But the gene absolutely does not cause Alzheimer's because there's millions of people that have this gene that never develop Alzheimer's. And the majority of people who do have Alzheimer's do not carry this gene. So what it's sort of hypothesized that this gene, this variation of this, there's a lot of different forms of this gene. This particular form of the gene is believed to be the oldest one in human evolution. So this gene came about during a time when we didn't have the kind of diet or lifestyle we have now. It wasn't where we were inside all day and we didn't ever get any sunlight and we're just sitting down all day, never moving around. And most especially, we did not have 24/7 year-round access to very, very cheap, instantly consumed sugar. and it seems to be that this gene is just the worst mismatch for the way we eat and live in the modern world. It's not that this gene causes Alzheimer's. Like, nobody's genetically programmed to get sick in this way, but when you trigger the increased susceptibility, because this gene is just not designed to thrive with the kind of diet we're presenting it with. Because I believe, if I'm not mistaken, there's a tribe in Nigeria that has a high occurrence of this gene, and they don't get Alzheimer's, but they live and eat very differently than we do in the industrialized world.
Wow, that's crazy. I don't know what to say. It reminds me of a tweet I did today, and it basically talked about how African Americans in America get a lot more hypertension than the Africans in Africa, and they have the same genes in a way, but yet you see this huge difference. So it sounds like my professors are right that you have to activate your genes, and the environment is part of that, and and that includes what you put in your mouth. That's an environmental factor. So that's amazing. So we have to activate our genes. So the key, and why this podcast episode is important, we need to know what activates the dementia and what activates, other medical conditions that lead to metabolic syndrome. So I'm curious if you think people should bother getting, I know they have these different companies, 20andMe, they have these genetic tests. Would you advise your clients to get genetic testing?
That's a good question. I think for testing for this particular gene is something that I think you can ask your doctor for, and they might be able to order it. You don't have to go through one of these companies to get your entire genome sequence. They can just look for this one particular gene.
Yeah.
And it's hard to say. I think it's good to know if you have it or not, but for me personally, if I knew I had it, I would just be even more careful than I already am about what I eat and how I do things. If I didn't know, I would still, enact all the practices that I could. I try to exercise, I try to get outside in the fresh air, I eat a low carb diet. I would still do that, but I might be even more diligent about it. And yes, I think you, it's worth knowing, but I find a lot of my physician friends used to do a lot of this advanced testing and genetic testing, and they said, it never really changed my clinical recommendations. I always told people, like, I still gave the same advice and the same basic principles. So if unless it's going to change what you're doing dramatically, I wouldn't bother testing. But I also see the merit in testing, because maybe there's somebody who doesn't really want to make certain changes, but knowing that they do have this majorly increased risk, because the gene does not cause Alzheimer's, but it definitely does dramatically increase your risk. So if you know that you have this very strong risk factor, that might be what convinces you to make some of the changes you might not otherwise want to do.
That's fair. I do feel that individualizing everything we do while having a population health mindset, where it doesn't make sense to just do a lot of genetic tests on people when you're going to do the same thing. So that makes a lot of sense. But you're going to have a few people that are going to be interested in you. Absolutely can, do that on their behalf. But my recommendation is, let's just adopt the right approaches to be healthy, and then in a way it won't matter. Let the chips fall where they may after that. So I think that's some good advice. It's not the same as doing maybe some genetic testing because you have a family history of breast cancer, and they just happen to have the BRCA gene and things like that. It's a slightly different animal, it sounds like. So I'm curious, since we're on the topic of the brain, and I remember when I talked to Dr. Ken Berry and even Dr. Sean Baker with the Meet RX group, and they both shared that they felt like the way they eat affected how they feel, how they interact with the world, from an emotional standpoint, a mental standpoint. So I'm curious your thoughts on the benefits, mental health benefits of eating a low carb diet and what you've seen in your practice.
Oh yeah, I will answer that happily in a second, but I'm glad you mentioned that you had Dr. Berry on because what we were just talking about, he has a phrase, he calls it, I think, the optimal human diet. And,
Yep.
that doesn't necessarily mean a ketogenic diet or a carnivore diet. It just means a real food, healthy, non-garbage diet. And so that's his answer, because people will say, well, I have X condition. Should I eat this? Or I have this. Do I? And when you call it the optimal human diet, the answer is obvious. If I have this gene, should I eat the optimal human diet? If I don't have this gene, should I eat the optimal human diet? Like, should I eat a healthy diet? Yeah, regardless of what gene you have or don't have, or what family history you have or don't have, can you eat a healthy human diet? Yes. So, in regard to the mental health, it's I truly think that so much of what we consider mental illness is very much physical and physiological, and there is I also feel there is definitely a component that is psychological and that can be retrained with cognitive therapy and mind and talk therapy. And I'm so glad you mentioned earlier, like, reprogramming negative thoughts and all that. I think that's so neglected in the health space when we're so focused on weight and blood sugar and all this. But there's definitely a physical and hormonal component to it, because I think so much of what we consider rage and panic attacks, and I see it like with road rage, it's probably hypoglycemia, because many of us know exactly what that feels like. You feel enraged, you feel suddenly infuriated, you get really angry, you want to just, strangle somebody who just has an interaction with you. And it comes on really suddenly and it feels very urgent. And I also think, depending on what somebody normally eats, those wild ups and downs in blood sugar can definitely cause mood swings. And from certain types of dieting, if you are insufficient or overtly deficient in things like B12 or iron or certain other nutrients, you can absolutely have mental and cognitive problems from that. B12 is a really big one, but there's other nutrients too that can really mess with the brain. And brain fog, not even talking about dementia, but just sort of garden variety brain fog, is one of the things that people report pretty consistently with low carb or keto, or even paleo, just even a healthier, lower carb diet. People report that their mental clarity is much sharper, and that their thinking is much more clear. And so I just think, I think when your blood sugar and insulin are even, you're able to deal with the world in a more rational way. You don't get quite as upset. You don't fly off the handle as quickly. And I think we see this in kids all the time. If there's any parents listening, you know what happens when you give your kids sugar and they're bouncing off the walls. I mean,
That's right.
adults, we do the same thing. We might just show it in a different way. We might show it with anger or with, irritability or anxiety or some other thing that seems like it's only in our head, but it's really coming from the rest of the body too.
Yeah, no doubt. And I think any parent, like you said, they would easily be able to tell stories about how true, even if you have a certain type of dietary plan in your home and the kids go to the birthday party, they're definitely going to come home and be a little bit more active than they were before they left. So our diet does matter, and everything you put in your mouth matters. So I think we're talking about reducing the sugar because it's a dirty fuel and it kind of wreaks havoc in the brain. If let's just say I have a family member who has dementia, and I heard that intermittent fasting was an option for them. But I look at them and I say, okay, this person is already thin. Is there a place for intermittent fasting for this, when or what you eat way of thinking that you have found to be helpful? Are there times when you can or can't use that?
Yeah, that's a really good question. It definitely depends. If we're talking about somebody that's already, very elderly and really in an advanced stage of this, I wouldn't want them to do any fasting just because they're probably already frail. They might already be underweight. If anyone is frail or underweight, please do not fast. Um, I think that what you eat and even more so what you don't eat is much more powerful than when you eat it. I really believe that. And I think there may be a role for fasting, like you were saying, if someone is not underweight, if someone does have some weight they could stand to lose. um, but I think just going on a very low carb diet accomplishes much of what we would want to accomplish through fasting without having to fast. But that being said, one of the benefits of fasting is that you go an extended period of time with lower blood sugar, lower insulin, running on more fat, possibly producing more ketones, which we haven't even talked about yet. But a lot of that can be accomplished just by being very disciplined about the diet. So I think fasting is probably more important. It's a bigger lever to push when you're not as diligent with the diet, like because you can sort of get Jason Fung. I know we mentioned Andy Fung, but the other Dr. Fung,
That's right.
FUNG
The
from
other one.
Canada. um, a lot of his, not all of his patients want to do a ketogenic diet, and they can get some of the same results through those people fasting versus
Okay.
somebody who wants to do a lower carb diet who may not have to do as stringent a fasting regimen. And one thing I also wanted to address before I forget is if somebody does have a family member that's affected with dementia, especially Alzheimer's, if it's very advanced, you can't really make much of a dent in that. And it's not that you shouldn't bother trying, but the earlier you catch this and the more mild the state, the condition is, the more likely that anything is going to help. I do think that with things with the brain, there could be a point of no return where no matter what you do, you're just not going to make a big dent in this. So, just know that if you're talking about a very very elderly relative who's really in an advanced disease state, it's really difficult to make a big difference there.
Yeah, it sounds like that's pretty critical. I'm so happy that you thought about that because I wouldn't want to give people false hope if I mean, if you got somebody that's like 1 foot in a nursing home for their dementia, that's a different person than a person that's starting to have some memory problems and maybe has a mild version of it. So thank you for saying that because although we want to provide hope with this podcast, we don't want it to be false hope. And I think the story that Dr. Andy Fung shared was a great story, but this guy clearly was at a point where he had some room for things to improve, those tangles and the things in his brain that weren't really, allowing those dendritic neuron connections to occur. He was able to do some reversal of that. So thank you for that. And I'm curious, you mentioned ketones, and I know you mentioned a B12 deficiency. Could you speak a little bit about the appropriateness of giving supplements? Because I tell my patients just like you do, which is you don't really need all of this stuff. You don't have to buy all these fancy supplements. However, in a patient who you don't want to fast, and maybe there's a way to supplement them to get some similar benefits. What would you say about supplements?
Yeah, I think I never supplement sort of willy-nilly. I would always want someone to be tested for certain things, and a B12 test is very simple to get. And just because of how critical B12 is for cognitive function, I think in anyone experiencing any kind of brain fog or cognitive decline or just sort of memory impairment, definitely get a B12 test. And the thing to know is that just unfortunately, the quote unquote normal reference range in the lab is too generous. You really want to be kind of at the midpoint or higher. You don't want to be on the low end of the range, especially if you're already experiencing some cognitive issues. So I do think, obviously, ideally, we'd get everything we need from food, but we don't always, depending on what we're eating. And in older people, digestive function is not always as robust, and they might not be absorbing as much of everything as we would want. So sometimes I think supplements can help. And with regard to the ketones, if not to get too deep into it, but part of the reason that a ketogenic diet might be so helpful for the brain is that we mentioned earlier that Alzheimer's is the result of the brain not being able to burn glucose for fuel very well. But it can the Alzheimer's brain will still take up and use ketones. So ketones are just yet another source of fuel that's a very clean burning, efficient fuel. And you can produce ketones on a ketogenic diet by keeping your carb intake very, very low, keeping your insulin level at a healthy low, your insulin level healthy and low. But if somebody is unable to do a ketogenic diet, there's people that are older that it's just really, really difficult to get them to change their diet, especially to something as different as a ketogenic diet might be for them. In those cases, there's something called exogenous ketones, which is like a ketone supplement. It's a powder that you can mix into water and drink as a beverage, or you can use coconut oil or MCT oil, which are just the fats in those special oils get converted more easily to ketones in your body, even when you're eating carbs. Even when you're not on a very low carb diet, the body will convert those oils into ketones. So if we consider those supplements, then I definitely think they can be useful for somebody that is specifically living with cognitive impairment or some kind of dementia. They will not undo the damage. I mean, again, it's like going back to those medications for type 2 diabetes or even the Alzheimer's medications. Unless we address the root cause, we're not really going to do a whole lot to improve the underlying situation. But again, like if somebody's not willing or able to do the diet, why not at least give the brain this fuel? Why not at least improve that person's quality of life and their caregivers and loved ones' quality of life at the same time? Why not? Like if the problem is that this brain is starving for fuel, let's just give it some fuel. Even if we don't fix the underlying problem, at least we can address the one issue.
Yeah, that makes sense. It's just nice to have some things that people can do that are actionable. I know in America, at least, we want quick fixes, but I think it's just nice to have some things that can maybe show improvement fairly quickly without having to, while you're waiting for people to maybe make the dietary changes. So I appreciate that. And I think the second to last question I'll ask you, it relates to the coronary artery calcium score test. And I even made a YouTube video that kind of talked about it a little bit, but at the end of the day, a lot of diseases, as I mentioned earlier, are vascular. So one of the forms of dementia is vascular. And I always tell patients, if you have vascular disease, anywhere, you have it everywhere. So that's a real simple test that people may have to pay out of pocket, but fairly good test to check for vascular disease. Do you ever discuss those types of tests with your patients to get a coronary artery calcium score test?
I recommend it. I mean, I'm not a physician, but if I have a client that if they have a concern about cholesterol, because that's a whole other topic that hopefully you'll get
That's
a
right.
cardiologist or something on to talk about.
That's
But
right.
if you have someone that has high cholesterol, there's a good chance that they have very clean arteries, so to speak, that their arteries are not clogged, quote unquote. And because the amount of cholesterol floating around in your bloodstream tells you just nothing at all about the calcification of your blood vessels or how clogged your arteries are. And so if somebody's concerned about that, I might recommend that coronary artery score. And it's usually to put their own doctor's minds at ease. So if someone has a cholesterol of 2
Right.
or 300 or higher, but they have a 0 calcium score, hopefully that doctor would be a little less concerned about their cardiovascular health. And then on the other side of that, you can have a relatively low cholesterol, but have very severe vascular damage. So I think that score is probably worth knowing. It's just like fasting insulin. It's one of those tests that people probably should know a lot more about and should be done a lot more frequently, but it's not.
That's right. Yeah, I've once I discovered the test for the plaques in the arteries and the calcium score. I recommend it all the time. Again, it's out of pocket, so that doesn't guarantee you people will do it, but it's just a more direct measure. So I was just curious about that, and I know we're kind of at the hour. So what I want to do is give you a moment to reflect on your own journey. And when you think about the aspects of the nest and rope, think about yourself and what you want to do over the next 12 months. What parts of that, nest and rope that you are personally going to try to work on?
Oh man. I, my own diet could always be better. My diet, but I really, how to explain this in plain English? I have a lot of negative inner monologue. I have a lot of
Mhm,
very toxic thinking, a lot
mhm.
of pessimistic thinking, and it gets in the way of me, I think, participating in a lot of life that I would want to. And I've only recently really considered how much it might be affecting my physical health. This
Yeah.
sort of, I don't know. And this virus situation has been really interesting because I'm a very extreme introvert. I like to spend a lot of quiet time by myself, and I work from home anyway, and I have no kids. So I automatically spend a lot of time by myself. And while I enjoy that, not having as much of an option to go out and be with people has made me realize, as much of an introvert as I am, I do also require that social interaction and being with friends. And I think that made it made my quiet time more attractive because I went, and socialized and would get exhausted being with people, and then I wanted to be by myself. And so when things get back to a little closer to normal, I look forward to just meeting. I just moved to a new city about a year and a half ago, and I know that sounds like a long time, but it feels very short. And I just need to start cultivating more relationships here, and going out to especially more of the local businesses and getting to know people. So for me, I could probably stand to lose about 10 pounds, but I'm pretty happy with my physical health. It's really more my mental and emotional life that I think I need to put more work into.
Yeah, I love those comments, and yeah, not the best time to move to a new city in the middle of a pandemic. So I think hopefully things will settle down very soon, and you'll get a chance to explore your community. I know we are living in this virtual world, so you can literally sit in your house and interact with millions of people. But that does sound like a plan. So I appreciate that. So first of all, I want to thank you for being with us today. I really do believe that today's episode was an episode of hope. Considering the stat I gave earlier about, so many people over the age of 85 will succumb to dementia if we do nothing different. The good news is that you have provided a great tool to help guide us towards a path where we don't have to anticipate a life of cognitive decline. That's not our destiny. And I really appreciate you providing that valuable information. So I want to encourage anybody who is new to this information to share the good news that there is hope. And we do have empiric data to support the work that Amy has done. And her book, The Alzheimer's Antidote, Using Low-Carb and High-Fat Diet to Fight Alzheimer's Disease, is available, of course, on Amazon and all over the place. And she does have a website. It's toitnutrition.com. And you will definitely see her on Twitter, where we met. And she's doing her To It Nutrition on YouTube, and also does some work on Instagram as well. So those are places where you can find her, at To It Nutrition on Instagram and To It Nutrition on Twitter, and of course To It Nutrition on YouTube. So just imagine if you're listening and you could be the one to share the good news to a person who's hopeless, or a family that's hopeless, that there's hope. Imagine being that person. If you think about this protecting your nest, it really includes empowering the ones around you with the tools they'll need to protect their nest. So, as we think about this episode and what it means for so many people, I just want to make sure you don't miss this opportunity to help someone that you love or know. So, Amy, thank you again for being with us today. And for those who are listening, we are going to do our Facebook, YouTube Live, and we're going to talk about weight loss stalls and what we can do about that. And for those who are listening, I want to thank you for doing that. And until next time, continue to protect your nest. You've been listening to Protecting Your Nest with Dr. Tony Hampton. For more, visit drtonyhampton.com.